As we know, perhaps 90% of heart disease is preventable. Perhaps 80% of type 2 diabetes is preventable. Perhaps the vast majority of dementia is preventable. Because I'm a great believer, Scott, that if people know more, they can do more. If they know better, they can do better and they can be better.
Welcome, friends. My guest on the show today is Dr. Mark Rowe. We're going to take a deeper look into lifestyle medicine. Not so much what it is, but in terms of how are we approaching medicine in the context of lifestyle medicine. And so we're really talking about what are the type of doctors that are really coming out of lifestyle medicine. What does that mean for you as a patient or as a physician, perhaps considering lifestyle medicine? And ultimately, I think where we take the conversation is, what does that relationship look like, both with a physician and a patient, but also our relationship with health and our approach to health. There's lots of things to complain about with health and healthcare, no question. But I think what you'll take from this conversation is a lot of opportunities that we can do on our own to improve our own situation and be part of a change that I think is coming in medicine, hopefully faster than most of us realize. I welcome you to our conversation. Welcome, Mark. Glad to have you on the show.
Thank you, Scott. It's a real privilege to be on your podcast. And greetings from Waterford, Ireland, to all of your listeners.
Yes, so let's maybe go right there right away. Waterford, Ireland. What part of Ireland are we talking about? And I want to ask you specifically about Waterford Health Park, because I think that's a really interesting area.
Waterford, Ireland it's Ireland's oldest city. It was formed in 949 AD. It's in the southeast. We're a big little place, so we population about 60,000. So it's quite compact. Most people know about pretty much everybody else in the area. And it's a lovely place to live. We're on the coast. We have beaches, we have mountains, and we have a beautiful quality of life here.
Lovely. That's it reminds me of a university town I was in Canada for many years. 60,000. It's a nice sized community, big enough to have a lot of things, but not a big metropolitan area and all the other things that come with that.
Absolutely.
Tell me about Waterford Health Park, because you have that on your website, and I wanted to ask you about that because in terms of being recognized and what that's all about.
You know, I've spent most of my career working at the coalface of primary healthcare as a family physician. And I've always wanted to sort of design a place that in itself would be health enhancing. In other words, that the facility would be uplifting to the surrounding community and that it would also make enhanced communication and positive health possible within the building. And that led me to buy an old convent, former Presentation Convent. When I bought it in 2006, there was just 4 nuns still living there. There had been over 70 in its heyday, and it was dark and it was old, but it was a beautiful building, originally designed by Pugin, who did Big Ben, the clock in London. He was a famous Gothic revivalist architect. And when my wife and I walked around this building on a very wet February day in 2006, we just felt a real sense of peacefulness and a real sense of possibility. And we felt it was perfect. We bought it straight away and got straight through a planning process. And in May 2009, the Waterford Health Park opened. Basically, we flooded the building with light and opened it up to have a very large entrance double height atrium where there's an organic cafe on site, because I really believe, if you value health, actions speak louder than words. So it's really about what you do, and everything you do or don't do is a demonstration of your values and your commitment to health and well-being. So we moved our pretty large family practice in there. Practice had, I think, 5 doctors at the time. Now it is 9, 6 nurses, a whole number of support staff. We got the government to take some space. In Ireland, healthcare is a mixture of private medicine, insurance subsidized, and also government funded, sort of like Medicaid in America. So they took some space for public health nurses and physiotherapy and social workers for elderly people and so on. There's a pharmacy on site, and in the middle of the building, there's a beautiful garden, which we turned into a healing garden for any member of our community and indeed our staff to come out to and sit and have a cup of coffee or just sit and relax. And I suppose the one thing we really did do with the building was we flooded it with light. And it's amazing how light can really transform a space. And the idea behind it, Scott, was to really normalize the health experience, to try and reduce the huge anxiety that many people have going to see the doctor. And I'm not saying we eliminated it completely, but I think we really did reduce it significantly. And it's a gathering place now. We've had a lot of, non-profit activities on site, whether it's concerts, health education talks. There's been a whole range of activities there over the years.
That's interesting that you say that, and thank you for sharing that because it reminds me of I've had a few doctors approach me over that same concept around recognizing what we're trying to do around lifestyle medicine is a lot more than showing up at a waiting room and then going into clinic, and the wraparound elements like from a I know one was asking about developing a park, much the same, but cardiologist, but really wanted to have some other healing aspects to it,
Mm,
and say the cafe, the restaurant piece where you kind of introduce them to some food
mm,
options, but really get that collaboration going, which is, and
mm.
not just the doctors working together, but where you integrate it into the community. So that sounds like a wonderful model. So for any physicians that are out there are interested in this, it sounds like Waterford Health
Well,
Park would be a great example.
Scott, we've had visitors from all over the world. I think 5 continents. We've had busloads of nurses from China have popped in. We've had physicians from as far away as New Zealand and Canada have come. Pretty much every room in the building, almost every room has a view of nature, which is really interesting. It's very therapeutic, health enhancing. Roger Ulrich did that brilliant research all those years ago called Room with a View, which showed how a view of nature can be so calming and can support healing and lower feelings of stress. And the health park, we're very privileged. It's been recognized. We won a Global Health Improvement Award called A Place to Flourish. That was in Chicago in 2013. And the building was shortlisted for World Building of the Year in 2010 in the World Architecture Awards in the conservation section. So it really is a beautiful place. And if anyone's ever in Ireland, please come down. You'll get a big welcome, nice cup of coffee or an organic smoothie. And it's just, I think, the spaces we live and work in can really be so incredibly health enhancing in such small, simple ways. Health is so much more than getting out and going for a run or getting enough sleep, even though these things can be important. It's in the really little things as well. Having a nice plant at your desk, being in an inspiring space, being in a space that is health enhancing, whatever that means, can mean so many different things. Small things can really make a big difference.
Yeah, and as you're speaking about it, I'm thinking certainly for the patient, this would be radically different than certainly in the US and most clinics when they go in, but also for staff, right? What like is I know part of what you focus on as well. Now I'm seeing the connection is burnout, right?
Mm.
So, but burnout is no doubt more than just a heavy workload, right?
We are incredibly resilient, and we can cope with any amount of workload within reason, as long as we have an opportunity to recharge from stress. And I think more importantly, as long as we feel valued and supported, they are really key ingredients. When they're not there, burnout can rapidly escalate. I've always been a believer in valuing my staff, in looking after their well-being. not by simply paying lip service to the idea, but through dedicated actions. And when I ran my practice, it was very much based on everybody was an equal. The secretaries at the front desks, they play a pivotal role in communication with our patients, and they're treated as equals by me. And I think that's really important. Of course,
Yeah,
burnout. Pardon?
yeah. Well, I'm thinking like for a lot of people when they talk about burnout, whatever career they're in, that's feeling like they're on a treadmill or on the wheel, just they're locked in a small space going round and round and really not getting anywhere. And that's just the physical environment you're describing there says it's in direct opposition to that sense of feeling just by having the outdoor space, right?
And Scott, sometimes the best lessons in life are not what we read in books or in university classes. It's through our own lived experience. And, I was able to conceptualize the Waterford Health Park having started out over a shop in the year 1999 and had an arson attack on the first premises, which was devastating at the time. And, I can actually put my hand on my heart now, 25 years later, and tell you, professionally, it was probably the best thing that ever happened to me. It taught me so much about resilience and grit and, about gratitude and being grateful for what you have and understanding that, it's on us as to how we choose to respond to any given situation. And then our next premises, while it was very nice, had one waiting room for the entire practice and everyone was squeezed in together, and having built that premises within a year, I realized, there's more to delivering primary healthcare than this. There's a better way. And that's when I went to look at the Bromley Bibo Centre in East London. And I got some inspiration there and I began to read about healthcare architecture. And, so it's really out of adversity that, leaps forward come from. And I'm a great believer in that in my own life, that everything that happens is an opportunity to learn something useful that can support you in making even greater strides forward, even if that's simply in getting to know yourself better. And then in 2013, I experienced burnout myself. We built this beautiful health park and all bells and whistles, as I described, and people really loved it. And yet we were in the middle of an enormous, it's been called since the Great Financial Depression. There's a huge financial crash that started in the US and spread to Ireland, and we had a huge property bubble at the time anyway. And as a result of that, there were tremendously harsh cuts brought into primary care. It was 40% off the top, which was huge for a practice like ours, which had a really high focus on quality. And we had 25 people on the payroll every week at that stage. And we got through it, but it was very, very hard. And I personally was in a situation where I was working harder and harder, at the same time feeling the rug had been pulled from under me in terms of my ability to, keep the show on the road, as it were. And around that time, a couple of people that were very close to me died within the space of a year. And I suppose maybe like a typical male and maybe like a typical male doctor, I didn't grieve at the time properly. And all of that caught up with me and I began to feel emotionally exhausted. And just, I suppose a sense that the harder and harder I was working, I was getting less and less done. And I eventually went and did what I would advise anybody that's listening or watching this to do. I went and spoke to somebody, and that was absolutely, empowering beyond measure to hand over to somebody else all the worries and struggles I was carrying on my own shoulders. And I realized from speaking to this very experienced professional that I was experiencing burnout. And I was the last person to see it because I suppose often we are. And I took some time out and recharged and came back stronger than ever. And really, after that experience that I really began to look at lifestyle as medicine. I began to look at, sustainable self-care for me as well as for everybody else. Because ultimately, the old saying, physician heal thyself. And so many doctors and nurses and carers are brilliant at caring for everybody else in the world. They're on automatic pilot doing it, as it were, but not so good at looking after themselves for all sorts of complex reasons. And so again, that was a great learning experience for me. And the lessons I've learned from that, I continue to put into my life now every day.
Yeah, as you're talking there, remembering one of my old physician friends who was a golf mate, and we'd go on vacation, and he'd bring his medical bag with him, but the bag was primarily, well, the physicians take it with them anyway, but he was into it every night to self-medicate to manage the lifestyle he was living at the
Oh my
time.
God.
And
Yeah, well,
like,
I suppose.
wow, yeah, but that's the habits we fall into, right? And as you're talking about the aspects there, that's in terms of what the practice is like. If there's feedback I get here from kind of the public, it's really around the standard is relatively low in terms of from a what I'll call a customer focus around
Mm,
and a staff focus around. It's all about kind of volume and the numbers we can push through the mill
yeah.
in the course of a day. And they don't like when I talk to them about I talk about like a a physician patient partnership,
I
like
like that.
how you show up. So clearly that's part of what you invested in with this is a broad partnership. You're talking about a partnership in the staff, right? It just permeates through all the relationships because ultimately you can't do what the patient needs to do for themselves, but at the same time they don't know the things that could help themselves that are relatively easy, right?
You're dead right, Scott. And I really believe that one of the things that people want most from their doctor, particularly in primary care, but I think throughout the whole medical system, people want to be listened to, people want to be heard, people want to be valued, and people want to be supported. And that can only happen if you give people time. And I think we took a conscious decision many, many years ago that we were going to focus on quality and we were going to absolutely prioritize giving people time. And to do that, we brought in a walk-in clinic so that people who were, inverted commas, sick on the day, they fell and sprained their wrist, or they've woke up with a really bad sore throat, or whatever it might be, can come and see the walk-in doctor out the front. But the rest of the physicians were on appointments that are just all scheduled care. And in fact, since the pandemic, actually, the walk-in clinic is gone now. That's another change from the pandemic. Uh, but that's working fine. In other words, giving people time. People want accessibility, but people really value time. And that's the one thing you need to do as a doctor is take ownership of your own workload, take ownership of your own career and your own trajectory, and to appreciate that this is one of the things you can choose. You might believe you can't change, but ultimately you can. And your future self, as I say, will really thank you for doing it, because by being able to give your patients more time, you can build a deeper relationship that's built on mutual respect and partnership. And I think people and patients really value that. And it can really lead to much more job satisfaction and really a great sense of fulfillment for you as a caregiver, as a doctor, or as a nurse, as a physician.
Yeah, if one of the things that I've found throughout my career is because I've been involved, typically I'm on the pointy end of things through innovation and scale up, and that was, I think, partly why a number of doctors were willing to rub elbows with me because I was not in the box that they had grown up in and had
Mm,
experienced. But we need to see these things, right? And once
mm,
we see it's possible, and so as you're as you're talking there, I'm hearing all the comments from doctors like, I just don't have time. Like, I
mm,
wish I could, but I don't have time. Patients
mm,
saying, well, I wish I got better care, but I can't even get it. I can't even get a primary care physician, right? So these are
mm,
the extremes. So it's as you say, like, so what are you going to do with the rest of your life? Like the
mm,
decisions you're making today are essentially setting the path. So one of them I try to kind of on the physician I think you're speaking to, on the patient side, I try to remind them that no matter what doctor you go to, the clock is running, right? Every
mm,
moment is precious. Use it wisely. It doesn't,
mm,
whether you have 7 minutes, 17 minutes, whatever it
mm,
is, yes, you want to have a relationship, but show up prepared to say, these are the things so that your doctor's pretty quick at connecting dots, right? It's not often just one thing. It's like,
mm,
well, that may be the symptom you're experiencing, but there's these other two things going on behind. Like, so burnout
mm,
would be a great example, right? How do you
mm.
describe the symptoms of burnout? That you don't talk about the work necessarily. You talk
Yes.
about the feelings associated with it.
Mm,
You got to peel that layer back to get to what's going on. It's you say you get a cut or a broken bone. That's what medicine is great at, right?
mm,
It was designed around that. So these other things take more time. And I find if you invest in yourself and you start to learn to listen to your body, you will get better at managing it and knowing how to communicate to a healthcare professional in an effective way. And then I would say also, you also get better reactions because when you show up, your physician says, oh, this patient is truly invested in their health. This is my ideal patient. I'll make more time for you because I feel like when you walk out the door, you're going to take
mm.
my advice more seriously than others.
And I think the corollary is true as well, in that, people will often, people will listen to what you say. I mean, you're a doctor, so you're a trusted voice. People will, take your advice on board to a greater or lesser extent, depending where they are on the wheel of change and so on. But people are very interested in what you do yourself. And if people, understand and know that you value your own health, that you take exercise, that don't abuse your body, as it were, and that you, as a doctor, as a caregiver, are actively interested in enhancing your own health and taking good care of yourself. That doesn't happen in isolation. Patients are very smart. They pick up on that and they can become very interested in well, what are you doing? What exercise program are you taking? What sort of foods are you eating? What sort of self-care strategies are you deploying? How do you manage your sleep? And people can be very interested in that, and I think that can give you great power as a doctor to influence people in a more positive direction. In other words, through your own actions as opposed to your own words. Because if there's a mismatch, if there's an imbalance, people pick up on that very, very quickly.
Yeah, yeah, it's a yeah. If the doctor's obese and smoking or smells of smoke, and
Mm,
generally is kind of lazy in their habits, it's I would say as a patient, I've pretty much turned off what you have to say, short of you can mend a bone and mend a cut and stitch me up and things, but in terms
and,
of
and
advice, yeah.
there was an old joke. I don't know if this is in the US, but certainly in Ireland, the definition of an alcoholic in Ireland was someone who drank more than his doctor. Because that was the thing. The doctor traditionally in the past was working around the clock, working early in the morning till very late at night, doing house calls till all hours, and then might be down in the pub having drinking a bottle of whiskey or whatever it is, because that's how the doctor dealt with the stress. And it's interesting, if you ask many physicians how they feel about their health, many will say they're doing well or they're doing just fine. But then if you look at the statistics, for healthcare professionals, and there are huge numbers of people experiencing burnout, mood disorders, depression, chemical addiction, type 2 diabetes, etc. The list just goes on and on and on. And so the reality is that, you know, doctors are human beings and are deserving of the same care that they would give their very best patients. And that starts with every doctor starting for themselves to realize they have the power to choose and the power to make changes. Mightn't be easy, might be really difficult, but it can be done. Changing your workload, changing your work habits, and changing your self-care and tilting the balance in a much more health enhancing direction. And I really think that's really so important.
The I think that kind of took us nicely to the next area, which you and I talk about lifestyle medicine as just
Mm.
everyday office type conversation. So maybe this is a good time to kind of step back and do the introduction to lifestyle medicine, because I think a lot of people think it's a little bit light when you hear lifestyle. We hear
Mm.
lifestyle around all sorts of things. Um, I certainly am always testing lifestyle factors and which ones are affecting me. I like to measure as best I can to try to see what how my body responds to it. But so when you talk about lifestyle medicine, maybe you can kind of walk us through what lifestyle medicine means to you as a practitioner.
What lifestyle medicine in essence means to me, Scott, are the habits and choices we make or don't make each and every day that can compound to synergize and have a significant long-term impact on our health span. In other words, the number of years we stay healthy, with some luck, our lifespan as well, though of course there's many factors involved with that. And perhaps even just as importantly, the quality of your subjective lived experience each and every day. So it's objective benefits in terms of health span, but it's also subjective benefits in terms of how you feel. And it's really a combination of probably, I would say, seven separate pillars. So obviously, there's the ones people will have heard of most, which would be the quality of the food you eat, the quality of the sleep you get, the amount and type of exercise and movement that you take, the ability to recharge from stress, which is so important. Obviously, the no-brainer, which is avoiding noxious substances, and certainly in terms of alcohol, less is more there. Number six, and perhaps, well, you can argue which one of these elements is the most important, and maybe it depends on the individual, but certainly the quality of your interpersonal relationships, it's so incredibly important to our well-being. And then number seven, time in health enhancing environments, particularly time in nature, is incredibly good for us. But also time in the arts. Going to an art gallery, or time, whether it's reading poetry or going to the theater. Again, I would consider that a health enhancing environment. So it's really these seven separate pillars that really interact together to maximize and optimize your epigenome, which, as we know, is like this master switch that sits on the top of our DNA, and it seems to control at least three quarters and perhaps up to 80% of how our genes and cells express themselves. In other words, the vast majority of our potential is under the control of our lifestyle choices. And that's really the essence of lifestyle medicine. And it's really, it's all about starting. It might sound like a mountain to climb if you're not doing any of those things right now, but it's all about starting, and start with a small little nudge in the right direction and build some momentum. And before you know it, 1, 2, 3, 5 years will pass by and you'll be in a completely different place. And that's really what's so encouraging, is that it's never too late. No matter what age you are listening to this right now, it's never too late to really adapt and become so much healthier, to really add so much more vitality to your everyday life and lived experience. And the other great benefit, of course, is you can significantly reduce and hopefully prevent many of these nasty chronic health conditions. In fact, as we know, perhaps 90% of heart disease is preventable. Perhaps 80% of type 2 diabetes is preventable. Perhaps the vast majority of dementia is preventable. So, this is really, really, really important. And of course, most of these pillars, to action these in your everyday life, costs very little except time and focus and effort. So we're not talking about anything that's very expensive in terms of dollars or in terms of financial commitment. But I think it all comes back to awareness and knowledge, because I'm a great believer, Scott, that if people know more, they can do more. If they know better, they can do better and they can be better. So I think, there's a great bridge um, to cross in terms of marrying these positive health messages with education, so that people get the ideas, get the message in a manner that enables them to consider making positive change. In other words, not in a way that's judgmental or lectury or telling people thou must not, or there you go, no wonder you've got X, Y, or Z because you didn't do A, B, or C. I think that's very counterproductive. So, it's back to your word about patients becoming partners in their healthcare journey. And I think that's really what the best thing the physician can do, is really by learning these skills of lifestyle medicine and learning how to support people in bringing about these changes in a way that is useful and meaningful and valuable to them. That can be very empowering for you as a doctor or a nurse. And it's, as I say, it's like having all of these extra tools in the toolkit. Medication can be life-saving, medication can be wonderful, but it's not enough on its own for people to have lasting well-being, clearly. And sometimes it's not appropriate at all. Maybe, there are much better options to consider besides just automatically first going for the pill.
Yeah, as you're talking there, I'm remembering an analogy that I use
Mm,
is to think about the epigenome as like the music for an orchestra. Right?
mm,
So you have a whole bunch of musical instruments sitting there up on stage, but without the music and then the training. And so if you trying to learn something new, we'll call it a new instrument. Pick which instrument, which would be which lifestyle habit would you like to make an improvement on, or which one has an opportunity. It'll take a little bit of time, but with a little bit of practice every day, it starts to get easier. And the squawking sounds, you say, I can't possibly play the violin or whatever instrument it might be. And then come back in weeks and months later, and you realize that's starting to sound good. And now, well, now maybe you can pick up the cello, and actually, because
mm,
that's not that different. And now you can move to some other instruments. And it's a way for people. I try to explain the epigenome is really what makes music beautiful. That's what makes your DNA function beautifully and
mm,
together as a symphony. And and the better you practice at it, you don't have to practice all day every day at it, but a little bit. It's that
mm,
discipline of every bit. I think that's the piece you kind of touched on earlier, right? When we say habits, people have these negative connotations. And when I
mm,
say discipline, that has negative connotations, but it's really what are those little things you do
mm.
each and every day, both positive, both negative? Those will have the biggest impact compared to the things you do that sound wild and crazy once a month or once a year.
Absolutely. And that's why I often encourage people. Um, I'm really moving away from using the word diet, diet, at all now, because I think it's actually ladled with negative connotations the more I reflect on this. But if you're talking about your nutritional habits, the idea of adding in more color, the idea of adding in more variety, perhaps the idea of trying to see if you can get 30 different plant-based foods into you over the course of a week. Getting in more variety from beetroot and blueberries through to red peppers and so on. These are positive things you're moving towards, as opposed to the word diet with all its connotations of suffering, restriction, punishment, and of course, the reality that most diets end in failure anyway because they're so time limited. You burn a massive hole in your willpower muscle, and often end up just feeling worse than before you started. So I think language, I think, matters as well. I think it's very important how you say what you say, how you give the advice that you give, and that you understand the wheel of change, and you understand where somebody is at in terms of that. And but as you said, I love the word encourage. If I was to think of one word to encapsulate my work as a doctor, I think I'd like to be seen anyway as someone who's an encourager to, because I think really that's the best gift you can give somebody, is encouragement, to show them the way, to enable them to make the changes, to support them in maintaining the changes. People are generally pretty smart, and they certainly don't like to be talked down to, and they don't like to be told what to do. Um, but if you can frame positive change in a way that somebody will buy into, in terms of them appreciating the gains, the perceived gains, the real gains, I think that's much more worthwhile. So unfortunately, traditional medicine, it often talks about, such and such intervention reduces the risk of, heart disease by 90% or whatever it might be. And that can be very important, of course. But for the person sitting in front of you, if they're hearing about their risk of heart attack or type 2 diabetes, it may not feel very real or tangible. But if you can invert commas sell the benefits of exercise, the benefits of resistance training, the benefits of time in nature as ways to enhance their well-being shorter term, as well as their longer term health benefits, I think that's much more likely to be successful.
Yeah, I take a similar approach with my students around the way we approach our finances or investments. Right? We
Brilliant.
have this goal of, if we're working through our career, that we want to invest something to have, we know we're going to need it in retirement. We're going to want it in retirement. And the better job we do at managing that, the more relaxed and freedom we'll have in terms of choices in our retirement. And so those investments are really, it's not a question of invest now so that you're going to live to X number of years, which you alluded to earlier. It's that what do you want those years to look like? But also, you said earlier, in 6 months, you'll discover that's when you get people to that point of when they can physically feel the change.
Mm,
That's when it gets easy, right? And it's not waiting for 25 years to see the result of the investment, or you finally paid the mortgage off. It's a great thing, but you can't experience what that feels like in a real sense when you say sign the mortgage to buy a new home. You
yes.
can when you write the last check, but there's a
Yes.
long time in between, and so you got to pay attention to, is the principal coming down on the mortgage. And the further you go, of course, it starts to come down faster and faster and faster. And you and I see this with patients in health all the time,
Mm,
and we just say, how can I share you with the world, right? And that's what you're kind of talking about here.
yes. And financial well-being is a very important part of well-being as well. And I really began to appreciate that when we had the financial crash in Ireland. I saw so many people at that time who were really stressed. They'd lost their jobs. They were under severe pressure from banks. They were living in fear of losing their homes. And at that time, I some people certainly needed pills or Prozac, but many more people needed more than that. They needed a sense of hope, and that led me to really look at, I suppose, some of the timeless truths from philosophy, the benefits of a written journal, the principles of reframing and radical acceptance of the Stoics. They're wonderful teachers. There's so much to be learned from them, and then the tools of positive psychology and how a gratitude practice, writing about your best possible future self. So many things that can enhance your well-being. It was really that sparked that for me. But even nowadays, I can honestly tell you that as having worked as a family doctor, many people suffer from financial distress, financial ill health, as it were, and they won't talk about it. Certainly here in Ireland, there's a huge taboo around that, and there's a huge lack of knowledge around basic financial health planning in terms of whether it's to do with pensions or saving. There isn't that there's a huge gap there, I believe. And, because I think while money will not make you happy as such, um, certainly not having a roof over your head is a major cause of unhappiness. And not knowing how you're going to feed your family is a cause of massive distress. So certainly money makes the world go round, and to have financial security and financial peace of mind, I think is really, really important. And it does come back down to education, and it comes back to, um, learning. It's never too late to learn. And I think there's so much more we can do as doctors to support people in that area by pointing them in the right direction to take some courses, or sometimes what we do in Ireland, if you do think somebody is financial distress, is a fantastic, it's called the Money Advice and Budgeting Service here in Ireland. And it's a free service where people can go, and where they'll have a full warts and all review of their finances, and they'll get help and support to put a plan in place to deal with their creditors and to come up with a budget that works. And I wrote about this in my new book as well, Scott. Things Your Future Self Will Thank You For, which was a number one bestseller in Ireland here recently. And there's a Japanese principle, I don't know if you've heard of it, called kakebo. And are you familiar with that, Scott?
No, I thought you were going to say Ikigai. So tell me about this
Yeah.
one.
The very old-fashioned idea of getting out a ledger or a notebook and tracking all your ins and outs, tracking every item of expenditure, everything you spend all of your money on. You keep a written record of it, and you put it into different columns. All the basics, the mortgage, as you said, running your car, groceries, um, and then, so basic needs, and then wants, and then education and entertainment. So it's really, I think that one of the great benefits of this approach is it makes you more mindful about your spending choices, and maybe it can bridge that tendency to be an impulsive shopper. I've seen this at times. People can become really troubled by impulsive, whether it's gambling or now online, or impulsive shopping through mobile phones. It's just simply so easy now. People can get into a lot of financial trouble. So this Japanese principle, it's a very time-tested way of becoming more financially aware, as it were, better able to make better choices. And I think I have some patients who've tried it and they found it very helpful. And I think it's a good idea.
Well, I think one of them is that if you wanted to do a financial plan, it starts with knowing what's your current spend rate, right?
Yes.
No planner can come up with a magic plan for you to be successful without knowledge around what are your past spending habits and how do they support your future success. And the other, which is I think where everyone struggles with, is particularly again going back to burnout, is but where you feel out of control.
Mm.
This
Oh,
is something
absolutely.
that is 100% and only in your control. No
Mm,
one else can do it for you. So as a place to start, a lot of people won't start because they're fearful of what they're going to find out. Well, you've kind of said the inevitable is inevitable, so you're okay with that, or you want to do something about it. And so,
mm,
again, we kind of come back to this around it, whether it's a health condition or financial condition. I can't help you if you don't want to do something about it.
mm.
But if you want to do something about it, there's a lot of tools that we have available that are surprisingly simple, right? These are simple actions, all the things we're
Yes.
talking about. And that's why I find the money discussion, it kind of removes the personal aspect of, one's health and things they may not understand about biology. But everyone understands if I spend a $20,000 on something I can't afford, they understand without knowing the numbers that's going to be a problem in 6 months or when the bill comes in 30 days.
Yes.
What am I going to do then?
Hmm.
What
Oh,
so
absolutely.
just maybe kind of from a just go up to the big picture here to give people an idea. Um, Americans have a hard time looking beyond their own borders, so I always look for opportunities to look outside. And what's your take on kind of public health? And I think particularly I'm interested in initiatives around children and nutrition because I would say that's one of our biggest problems, right? Is we don't set people up for success early in life,
Hmm.
particularly here in the U.S. I don't think there's much debate about that with anyone. What's your thoughts on
Well,
Ireland, the UK, Europe?
I mentioned earlier, Scott, about health enhancing environments. But of course, there are health depleting environments, and unfortunately, that is the world most of us, and particularly most young people, are subjected to. I remember reading a number of years ago that the average child sees a million commercials on television before the age of 21, advertising high fat, high sugar snacks. I mean, that just blew me away. And almost no advertisements about the benefits of fresh fruit and vegetables. So, we have a huge problem with that. If people go into supermarkets, uh, you know, uh, traditionally the sweets and the chocolate, they're there at the checkout just to tempt the young child when the mother is going through, probably frazzled from doing her shopping. So, there's a huge issue we have a huge issue with obesity here in Ireland and growing. It's following in the footsteps of the US. Now, I was on the first ever Healthy Ireland Council, which was set up in 2014, really to try and um, look at these issues. And they brought out some fantastic initiatives in the last couple of years here. And to their credit, I did see an advertisement on Irish television only last month, and I don't watch much TV, but I happened to see this one. And it was showing a child in a supermarket and highlighting that the snacks were at their eye level. And it was a really compelling advertisement. And I said, good on them. That's a really powerful message. So, you'll never exercise your way out of a bad diet. I remember reading that line, and it's so true. So, you know, they've brought free meals, free school meals into Irish schools now, but there's a big controversy lately about the quality of the nutrition. I think it's very patchy. I think we're at the stage in Ireland where there is growing awareness of the harm, or at least potential harm, of the nutritional choices that our young people are making. And that's where it all starts. It starts with awareness. And there are calls for change that are starting, but they still have a long way to go. And of course, you always wonder um, why things don't change. When people like Scott Fulton in the US or Mark Rowe here in Ireland and many others around the world, many other good people who are interested in supporting positive health and are interested in lifestyle as medicine and so on. with all of those voices, why doesn't change just happen? And the reason is, to quote Machiavelli in The Prince, um, the people that are wedded to the existing way of doing things will conspire against change. And that is so true. There's a lot of vested interests in the world that are happy with the way things are. When you think about that, if you follow the money, if you look at big food, if you look at big pharma, if you look at the big players in the ultra processed food industry, um, they have a vested interest, understandably, in selling their products. So the power of advertising is very influential. We're all influenced by advertising and marketing. Otherwise, those specialties wouldn't exist, right? So, I think there is a growing momentum for positive change, but it's going to take time and it's going to take commitment, and governments are going to have to invest in this to make, I think, try and make healthier options the easier option for people. Because remember, people certainly in Ireland are increasingly stressed. They're increasingly busy and time poor. And when people are chronically stressed, whether it's from work and not recharging from the stress, being too sedentary, and maybe being sleep deprived, maybe drinking a little bit more than they should at the weekends, and so on. Now, that stress burns a big hole in your willpower and your ability to think more broadly and laterally, and your brain is simply going to crave more and more sugar. So, this it's it's complex, and all of the different elements are interrelated. It's not as simple as looking at um, advertising, um, healthy foods versus sugary snacks and so on. It's actually much more complex. But it's really at an environmental level, building healthier societies. It's making healthier choices, the easier choices for people.
Yeah, I think so. It sounds very similar to what the
Mm,
experience is in North America. And while the U.S. is perhaps leading the way down that spiral, Canada and other countries are clearly dealing with it. There's just a time lag that they
time
fall
lag, yeah.
behind. Yeah,
Hmm.
the as you're talking there, I think a couple things came to mind. Is one is if a product is being advertised, there's more than a 95% chance that you have no need for it. That's why they need to advertise it. It's because it's not something you recognize as a need, so they're creating a desire, right? So
Wow.
the fact that it's advertised, just do a self survey. Look at the advertising you see over the course of a day and say, does that provide the basics of life of things that I actually need? And you'll find they're advertising things that you don't need or that you can't buy. So in the US, for example, one of the biggest advertisers are pharmaceutical drugs. You can't buy those,
Mm,
but it's an idea of when you go in and you can ask your doctor for a drug.
mm.
Your doctor's in a far better position and knows all the medications available to treat you the best, their
Yes.
ability. You coming in asking for a specific drug that you heard about on television, and it just astounds me the amount of money that is spent on that. And the
Mm,
same, when all of the Red Bull and all the other things that
mm,
really don't add. Well, it's not add; they harm life, right? So.
mm,
And maybe the other kind of you talked about too, I think I'll maybe come back to is all of the things we're talking about are promoting abundance. When we talk about lifestyle medicine, particularly when you
mm.
talked about diet, everything we're talking about here is a more abundant life that's available to people. And that's hard to believe because I think you go back to smoking as the example of it's all about cessation. You need to stop doing this, stop doing that, stop doing all
Mm,
these things. And that kind of behavior, I think, has permeated through society, which is why I kind of say that discipline has a negative. But in reality, if you flip it around, when you talked about food or diet, for example, there's way more options than people have any concept of once you stop and to say, every week I'm going to experiment in one new area. Just bring in
Mm,
one new food item a week,
mm,
right? That's easy. And you look at a course of 6 months and realize that's 26 new foods,
mm-hmm.
right? That you never knew about before. It's going to get hard to find more because there's going to be so many. It's not that you're going to love them all, but it's the experience and awareness that I think is missing from people because, like, we all get busy in the routines. We keep doing that habit we've been doing and believe that that's the best way because we don't have time to look beyond what we've been
Mm.
doing, right? Um, so I'll maybe we can wrap it up here. And so one of the ones I wanted to raise up was on your website, or you've got Vitality Mark. Maybe you can just talk about what that is, because I went to it before we got on the show and went through, and I think that's a
Yeah.
great accessible tool for people.
Oh, thank you so much, Scott. So, I've really always been interested in, well, how could you measure well-being, or how could you measure well-being in a way that simply allows people to see where they're at and then maybe measure improvements over time. So, I wrote a book about this 3 years ago. I called The Vitality Mark, and was really showing how all the elements of our well-being are so interconnected. And I called it the hand of vitality. So you start with the little finger, and that's your emotional well-being, which is all about it's all about gratitude, it's all about kindness, it's really all about flourishing in essence. Your ring finger is your physical well-being, physical vitality, which of course is your nutrition, your exercise and movement, your sleep. The middle finger is your spiritual well-being, which of course is your sense of purpose, it's your sense of values, which may include a strong sense of faith, and it's your time in nature. And then the index finger is your mental well-being, which is all about your sense of presence, your sense of grit and growth, and you're focusing on your strengths as opposed to your weaknesses. And if you reach out that your hand, Scott, to shake hands with somebody else, your thumb points back towards yourself. And that's a reminder that that's about relationships, but it's a reminder that all sustainable self-care starts with you. And by you taking care of yourself, that in turn can support everybody else. And this hand, all of these five elements are interconnected. They're in an environment which could be health enhancing or health depleting. And one small change in one of those five areas can have a compound benefit on all the rest. And we're all unique, just as your thumbprint is unique to you. So the exact menu for what will give you optimal well-being and vitality is unique to you too. So I just developed a little questionnaire based on that, and it's available free through my website. And it's really to encourage self-reflection and encourage people to think about, yeah, well, how am I doing in these different areas? And what might a slightly improved version of that look like for me? And I love your word experiment, because to experiment with something, to try something, that's a place uh, of no judgment. It's a place of more, as I say, a place of more peace and purpose. It's a place of more abundance. It's a place of more connection, and it's a place that allows you to live with more vitality and to never stop growing, to never stop learning, and to never stop starting.
That's beautiful. It's a word. I guess I come from research. I have used that in countless cases of people fearful of change,
Mm,
and this notion of once you try something that it's forever, and it's like, no, let's try it. Let's commit to try it for some short period of time so we actually can make an educated or informed decision on it. So because you didn't like it 20 years ago doesn't mean you won't like it now.
yes.
This isn't a forever decision. Let's just try. And once you kind of get people over that, oh, so I'm not ever, so I don't always have to do this or never get to do that. Um, it's for people. It becomes very empowering, and it takes down, essentially breaks down that barrier of fear of change. So it's a yeah, it's a powerful, because then once you experiment, it means you might start to measure. And once you can measure and you can see yourself making progress, it's you now start to build some pride around it and say, I
Mm,
can actually see myself improving, whatever we're
hmm.
talking about, right? Um,
Absolutely.
yeah, it's a wonderful concept. Well, Mark, I want to thank you so much. I had no idea we were going to get into so many of the areas in our conversation that we did today. I feel like it's only just begun, and so hopefully we can have you back on the show because I think
I'd love to. An
while
absolute
I know
pleasure,
many
Scott.
lifestyle medicine doctors, you are clearly well informed in many areas, and I think you have a lot to teach both patients and physicians. So we need as much of you as you're willing to invest in us. So thank you very much.
Well, thank you so much, Scott. My absolute pleasure, and I look forward to connecting again really soon.
Great. And your latest book is,
Oh, it's
remind us
called,
again?
it's called Things Your Future Self Will Thank You For. Here it is there.
There we go.
And
And I'll put the link in there as well. Yeah.
it's on Amazon, and it was such a joy to write it, and to get the finished version in my hands there just before Christmas was wonderful. And as a patient was complimenting me on the book last week, and I said, you know what, Jimmy, there's no point in having knowledge unless you're willing to share it. And there's such joy and fulfillment from sharing what you know and from being open to learning. Because I always say I've learned so much more from my patients over the years than I'd say than I've ever taught them. To be honest, I mean, it's very much a two-way thing, isn't it?
Yeah. Well, and you learn in the course of writing because
Oh,
once
absolutely,
you and I can say all sorts of things here, but once it goes down into print, it had better be true. So you kind of find yourself having to
absolutely.
go back, right?
You're dead right.
Okay. Thank you very much, sir. Really appreciate you joining us and very best until next time.
Thank you, Scott. Have a great day. Bye.
Bye bye. Hope you enjoyed today's show. Great to have you part of our over 10,000 strong WealthSpan community. Remember to subscribe if you'd like to learn about our upcoming shows. And as always, make sure you provide some feedback, whether that's a thumbs up or a comment, a question. They're all welcome. If you'd like to subscribe to our quarterly newsletter, you can do that at wealthspan.com. We're always looking for show ideas, or maybe you think you'd like to be a guest. Again, please reach out to book a motivational talk or inquire about our leadership workshops. Email me at info@wealthspan.com. Until next time, stay engaged, stay curious, take good care of you, those in your care.